Alright, so a better way of actually naming this lecture could be that I would have said introduction and understanding hematuria, because this lecture will actually give you an in-depth knowledge of what hematuria is. Okay, with just a few slides, I actually went through almost everything that has to do with hematuria. Okay, so this is an introduction lecture before we actually go on talking about the various classifications of hematuria and all that. So first of all, what is hematuria from the student point of view? All right, hematuria is more of like, okay, um, these these types of urine up here, they are normal urine. Okay, but if you're having a color change in urine, and most of the times if the color is deviating towards red, you know that there's a problem. Normally, red color means there's a problem. Okay, so hematuria simply means what? You are passing out blood in urine. Okay, and it has different causes. Right. So let's have the overview. We still talking about all of it when we are in the lecture. So we see that hematuria is actually what? A medical name for the presence of what? Blood cells in urine. Okay, you're having blood in urine. Okay, now these healthcares will label blood in urine as gross. That gross, that means what? If you just leave the blood sample, you can obviously just know that is what? Blood in urine. It could be microscopic. That means what? You suspect that it's blood in urine, so you want to do further tests. Alright? It could be dipstick. You verify this type of hematuria using the dipstick test. Alright? So this gross hematuria occurs when there's enough blood present in urine that it is visible to the naked eye. Alright? It can also turn your toilet water a pale pink or bright red color. So the patient will come to complain to you that when they were urinating, the toilet water, that's toilet water from the water closet, actually turned red. Do you understand? So that's a powerful type of hematuria which you can just know by looking at it. Okay, you might just want to do some tests just to confirm and have a documentation. So talking about microscopic hematuria, this one happens when your urine has blood in it, but the amount is too small for humans to see. All right. So actually, you just need a microscope to confirm this. All right. Then this dipstick hematuria actually results from what? Oxidation of a urine test strip, and this can cause a color change. So the dipstick, when you put it in urine, depending on what is in the urine, to be changing the color and all that, right? So it doesn't always mean that blood cells are present in your urine. Dipstick tests have relatively high false positive rates, right? So hematuria is a condition in which blood is present in urine. It can either be gross, meaning it is visible to the naked eye, or it could be microscopic, just going over the same thing again, right? Or you could still say it is abnormal presence of what? Erythrocyte. So instead of saying blood cells now, you are now trying to put in some terminology and feel like a bad guy. All right. So it may be idiopathic. That means what? There's no known cause. All right. It may be benign. All right. It can be a sign of a disease of kidney or urinary tract. Definitely, when you see blood in urine, you know that there's a problem up there. Okay. That's if there's a known cause at all. Okay, but if it is idiopathic, you check, you will not still see any known cause. All right, then occasionally hemoglobinuria is used synonymously, although more precisely this hemoglobinuria is basically different from what? Hematuria. Okay, hematuria is like passage of blood, whole blood, right? Hemoglobinuria, that means what? There's destruction of red cells somewhere, so only hemoglobin is being passed out in urine. Okay, and hemoglobinuria is quite different from what? Hematuria. So just review again the different types of hematuria. I'll be having a special lecture on it. We have them like glomerular hematuria, which you say that the causes of hematuria is from the glomerulus. Non-glomerular hematuria, this one will say that the causes of hematuria are outside the glomerulus. Then we have the isolated hematuria, we have the asymptomatic hematuria, we have the symptomatic hematuria, we have the microscopic hematuria, we have the macroscopic hematuria. Okay, so it will just be a good ride for us, right? So that's it. I'll see you guys next one.